What's cutting edge in this sector has been around for a long time in other sectors.
Okay.
So what's happened around gaming and couponing and social networking over the last decade has now come to healthcare.
How do you social network for health?
Oh, lots of ways. I mean,
Okay.
there's social networks where doctors can connect with other doctors.
Okay.
There's social networks that patients can connect with other patients, and now there's social networks where doctors and patients can connect. But the notion is using your social graph to do things that you couldn't have done 5 or 10 years ago. So if you go to patients like me, where everybody from people with ALS to breast cancer congregate, people share openly lots of information about themselves. If you look at what's happening with Runkeeper, with people's fitness and sharing different experiences together, people are sharing. Everyone thinks people wouldn't share, but people are openly and openly and transparently sharing with each other for all in the spirit of helping each other and helping move the ball forward. But the big opportunity across all of this, I mean, with mHealth and mobile health, mHealth, I don't even think you're going to have this word M or mobile in front of health 5 years from now.
We'll just call it health.
Health,
right? Yeah.
The big thing is there's an opportunity to help lower the cost of healthcare in our country. And so instead of $2.5 trillion being spent on healthcare, we can start to use it to create a more efficient doctor visit. We can help make it less frequent for people to be readmitted to a hospital 10 or 20 days after they leave the hospital. And so the notion of everybody coming to the table with new solutions to try to figure out how we can work together to, again, bring the cost down and improve the outcome. And I can tell you from Startup Health's perspective, it's all about the entrepreneurs, and it's all about how do we educate entrepreneurs, how do we educate investors, how do we educate all the stakeholders involved with health and wellness to look ahead for a decade and say, let's transform healthcare together, let's create a platform for entrepreneurs to be able to work with doctors, to be able to work with investors, to be able to work with large organizations and large hospital systems and cooperate and collaborate to make this happen. We've chosen to focus on the U.S. right now. However, a lot of companies and entrepreneurs have applied from Israel. There's a lot of great companies coming from Canada, and there's a lot of application for all of the technologies that are here in the U.S. to be applied across the globe.